Okay, so I had chapter 4, which is psychodynamic relational practice. And a little introduction, psychoanalytic theory played a huge role in influencing social work practices from the 1920s and 30s until the 1960s. And then that all kind of led to the development of psychosocial practice. This approach helped show how social workers understood clients' inner emotions and the lasting impact of their early life experiences. So today I'm discussing psychoanalytic theory as a whole with a specific focus on its application to children in foster care because I have an internship with them. And so that's an area that I have a lot of time spent in. So psychoanalytic theory emphasizes the idea that unintentional and unconscious ideas and practices influence a lot of what is going on in a person's life. So, things that happened in their early childhood, like relationships with primary caregivers and trauma that may have happened there as well, does play a critical role in shaping their emotional development, their personality, and their patterns of relating things to others across their lifespan. So it doesn't just affect them in childhood, but it goes on the entire way into adulthood. A core assumption of psychoanalytic theory is that much of human behavior is influenced by the unconscious, like I said before, which means that individuals are often unaware of the underlying emotional conflicts that guide their actions. This makes psychoanalytic theory particularly relevant when working with children, especially in foster care or other individuals with trauma, because they often experience early relational disruptions. And those relationships being disrupted early in their lives really affects their unconscious ideas of relationships going forward in life. According to our textbook, The Modern Social Work Theory by Payne 2020, this approach is generally more appropriate for mental health services and long-term engagements with clients and is less well suited for short-term help or situations where the agency's primary focus is delivering concrete social care services. Despite this limitation, many psychoanalytic concepts do continue to influence modern therapeutic strategies, such as crisis informed and strengths based different approaches, because it goes off of the fundamentals of unconscious practices and early childhood. Some of the core like psychoanalytic concepts of the theory is that at the center of psychoanalytic theory is the belief that early experiences become internalized and shape how individuals perceive both themselves and others, as well as the relationships between the two. Sigmund Freud, one of the big theorists in this theory, proposed that personality develops through interactions among the id, ego, and superego. But more importantly, that more contemporary and recent theorists say that the approach places much greater emphasis on relationships between individuals and their attachment and attachment styles. And the emotional development is more of it than just the id, ego, and superego alone. One key concept, like I said before, is the unconscious, which refers to the thoughts, memories, emotions that are outside the conscious awareness, but still influence behavior. Especially in children and those who've experienced trauma, may not be able to cognitively or verbally express what they're feeling or why they're feeling it. For example, like emotional pain and things like that. But they are able to show that distress in terms of behavior rather than saying it out loud. So some of those examples are regression, projection, and denial. For example, a child who experienced neglect may regress developmentally and engage in behaviors like bedwetting or clinginess when they feel emotionally unsafe. And that is not a sign of them physically being inadequate or at a different stage of their life. It's just that subconsciously they're regressing because of the trauma and emotional pain that they have been through. Children can also internalize thoughts and behaviors, which through a psychoanalytic lens is seen as a result of that unconscious childhood trauma. Later, psychoanalytic theorists expanded this framework through object relations theory and other theories such as that, which emphasize how early relationships with caregivers are internalized as mental representations, meaning their early relationships with adults are seen as how they expect all relationships with adults to go throughout their entire lives. So these internalized relationships shape expectations about trust, safety, emotional availability, things like that. For children in foster care who bounce around a lot and don't have one primary adult that they can trust, those early caregiving relationships are often inconsistent, or if it's before they get taken out of their home, it can be often harmful, which can then deeply affect how they view the world and how they create relationships with others, which is very unfortunate and something that in situations like Child Protective Services, they do try and help, but it unfortunately, with the way the system is right now, is something that is almost inevitable just because they do end up bouncing around so much. So, kind of shifting gears and focusing it even more towards foster care with a few examples. Children in foster care frequently experience multiple forms of trauma, including like abuse, neglect, possibly the removal from the parents could have been very traumatic, and having unstable placements. And so, from a psychoanalytic perspective, these experiences disrupt the development of that secure attachment that happens in that early childhood and creates internal working models that frame relationships as unpredictable and unsafe. And so, like, for example, consider a child in foster care who is very emotionally withdrawn and resistant to forming bonds with caregivers. I have a couple of clients like this right now. And psychoanalytic theory would interpret this as a protective response because earlier in their lives they had only negative experiences with adults and caregivers. And so now that they have the opportunity to have a good one, they don't know how to do that. And so subconsciously, they just immediately assume it's not going to go well. And so they don't even try and make that relationship to save themselves from the pain of what could happen. In a 2024 article, Do Attachment Educator Characteristics and Youth Educator Relationships Matter in 6-Month Changes of Institutionalized Adolescence, by Muzi, Rajier, Busy, and Pace? The article highlighted the importance of connection between adolescents and adults in order to help them have less destructive internalized behaviors. In the study, there were 36 youth who were institutionalized and 25 educators. And they not tested, but they talked to both of them at baseline and then 6 months later in like a longitudinal kind of aspect. And the youth were assessed in their total internalizing and externalizing behaviors via like a multi-informant approach and things like that. But the bottom line of that study was that they found that attachment-based assessment of youth and educators can inform intervention to foster youth improvement, and that through having those strong connections with adults, it does help them to eventually have less difficulty having relationships with adults in the future. Again, like emotional outbursts and aggression can also be understood as different expressions of that unresolved fear, anger, and grief that a child cannot yet process consciously, especially in the younger kiddos. These behaviors may reflect in repetition and compulsion and some of those OCD-like tendencies because the unresolved relations and things like that, they want to keep that from happening in new relationships with their foster parents or their teachers or caseworkers. And so they do a lot of those checking behaviors and repetition because they figure if they do it in a different way than happened before, it might have a different outcome. And so even psychoanalytic theory says that with that, it's not necessarily that they're trying to, it's that subconsciously that is how their body knows as like their defense mechanism. And so that's the way they're going through with it, even if they don't realize that's what's happening or that's why they're doing it at all. So this perspective kind of shifts the focus from a controlling behavior to understanding that there's emotional meaning behind the behavior, and that it's not just that, oh, their subconscious may be telling them to do this. It's that subconsciously they're doing this without realizing it. And so we can't help them in any field with any theory without realizing that and acknowledging that we have to start there to be able to figure out what we can do to help them next. So some of the strengths, which that is one of them, is that it kind of does help to give a baseline for all of the other areas and experiences that might be needed to help them. But a major strength of it is that it can help family members and other caregivers make sense of like difficult, frightening, or like incomprehensible behavior that they might otherwise not understand the cause behind it. So, this is especially relevant for the foster parents and caregivers who may struggle to interpret the trauma related, like different practices and things like that. So that's one of the major strengths, but also that it places an emphasis on understanding behaviors as meaningful rather than pathological. And it helps practitioners to ask why a child is behaving a certain way versus just eliminating something that causes that behavior and thinking that it will fix the problem. For children in foster care, this can also help them not be labeled incorrectly and given a diagnosis that may not actually fit them, just because it sounds like something that would put a band aid on the problem and be able to move on from there. With that, also, psychodynamic practice helps caregivers and practitioners and family members all kind of make sense of the reactions that may otherwise appear irrational, disruptive, harmful, things like that, which can help to reduce blame towards that individual and also increase empathy. Another strength of the theory's focus is on attachment and early relationships, like I said before. And psychoanalytic theory really recognizes that emotional development occurs within relationships. And so, even if they did have a really rough past, and this is for anyone, not just children, but it's going to have long-term consequences, but that also that is not the end all be all, and that there is still the opportunity, excuse me, for them to carry on and to be able to heal from that trauma and go on to have normal relationships throughout their life. So that also just goes to show you the importance of stability at any point through their lives, even if it wasn't at the very original point. Psychoanalytic theory, and I feel like a lot of the theories in social work do go to show that no matter when it is, a person can still be helped and they still have a chance. It's just a matter of knowing how to get to them and how to help them through it versus just stopping and saying, well, something happened. We can't do anything from here. One big part of that is validating all of their experiences, emotional, physical, all of them. And so psychoanalytic theory does acknowledge that behaviors such as withdrawal and anger and regression and all of those things may be responses to that overwhelming stress. And so it's not just the subconscious, but it's also that it does kind of present physically, but that's still part of it and part of it. You can still get through that. And that's kind of aligning with like trauma-informed care and things like that, which, as if you haven't figured it out yet, psychoanalytic theory really plays into a lot of the other theories because it was founded more in like the 1920s to 60s range. And so a lot of the more recent theories based pieces off of it. I will say one of the major limitations of psychoanalytic theory is that it has a heavy reliance on like the participants' input and insight into what's going on. And so clients who disabilities or are nonverbal or different things like that that make it so they can't as easily express what they're feeling and why they're feeling it, it is a lot harder to help them using psychoanalytic theory because they're not really able to tell you what's going on. They have no idea what's going on. And so you as the practitioner and them, it's kind of a struggle to figure out who is even able to do what with that information. And so sometimes practitioners who have clients like this and they can't understand what's happening emotionally, they're not really able to help them using this theory alone. And so they have to either combine it with something else, such as trauma-informed care or CBT or something like that, or simply switch them to a new provider if all they really practice is psychoanalytic. So this can also be an issue with, in my example, children in foster care because psychoanalytic theory really focuses on set measures of support and at certain times. So, for example, like having meetings with the clients so many days and so many times. But children in foster care who jump around a lot, they might not be able to have someone who can take them to those meetings at set days and set times. And so it's really just a matter of finding what works for them. But sometimes psychoanalytic theory alone is not what works for these kiddos. Also, because it is traditionally non-directive and it doesn't give outright advice to people, sometimes in systems like child welfare or prison system or things like that that require a very prompt response, it can't always work because you cannot have those immediate interventions that are put in place to help with risk assessment or things like that. And so, while it can be very helpful, it sometimes isn't the best case for what's going on. Traditional psychoanalytic theory and treatment, not theory, is also a very long-term, intensive, resource-heavy kind of experience. And so those foster youth who are maybe don't have the money to pay for a lot of therapy or any therapy at all and are still struggling to find the right provider or find someone who can cover that through insurance or one of their programs. If they're bouncing around a lot, it can be very difficult for them to have to settle with a new therapist every few times they move and try and get back into the same swing of it, which is kind of the case for any therapy, no matter where, but it's just something to keep in mind about a limitation that it could have. Another limitation is the theory's tendency to individualize the stress. And what I mean by that is like they focus on what could go wrong in a situation and what did go wrong versus the big structural factors of, oh, maybe the children and youth system is flawed and maybe it did not need to be this traumatic when you got taken away from your mom because your mom went off in handcuffs in a police car instead of maybe we could have separated you from that before it happened. And so some of those factors are not at all considered in psychoanalytic theory. I have a client right now who she did watch her mom go away in handcuffs, and it was a very traumatic experience. She can't really talk about it because she's quite young. But if they had just removed her from the situation beforehand, which from what we've heard of the situation could have been possible, they just didn't do it, it would have saved her a lot of that trauma. And so that's something that psychoanalytic theory on its own really is not equipped to handle because it is based so much on their very young childhood and unconscious. And that is very much so a conscious thought that she has, and she has memories of it. So kind of overall for like how it plays into power and culture and populations as a talk therapy, it really works best with clients who can express themselves, like I said. It also works really well for clients who are able to understand that they have needs and that they want their needs to be met. For clients who are involuntary and not necessarily even wanting to talk to you, it isn't something that can get very far, at least not outright, because there needs to be some sort of relationship with the two, the client and the provider, to be able to establish safety and a sense of security enough to get into these things in a way that otherwise would not happen. So some other things that can happen is if you're working with a young child, it can be very hard because if you bring up a memory that they might have had and help them kind of come to terms with that, they might not have the coping skills to be able to deal with that yet. And so a lot of times, even before you can get to the psychoanalytic, psychodynamic portion of this, as a provider, you have to offer them the coping skills and get them to a point that they are able to understand these really big feelings in a really little kid, to know what they need to do to keep themselves safe and to help themselves before even going into the actual like psychoanalysis part of the therapy. It also, in the social justice system, like I mentioned before, it doesn't really help with the programs at whole. It just kind of helps with the person in the moment. If it needed to be adapted, I think it could align more closely with a strengths-based focus because the defense mechanisms that are highlighted in it can be reframed as survival strategies rather than just you are dysfunctional, this is why you're doing it. And emotional responses can be seen as a sign of resilience and a sign of growth. And so I think a reframing in some capacity is very good in this case to be able to deliver what we need, and just to see how it goes. In conclusion, the theory offers a deep understanding of how early relational trauma affects development, which makes it especially relevant for children in foster care. But at the same time, it does have limitations in terms of social inequities and culture and adaptability and accessibility that really depends on the group to be able to see how well it goes and how well it is actually helpful. So, with that, I'll go to the discussion questions. Um, like I said earlier, this whole thing kind of raises important questions about whether psychoanalytic theory can truly align with like the social justice values when working with children in foster care, or whether it has to be like fundamentally adapted to be able to avoid reinforcing individual blame and things like that. So, in what ways do you think psychoanalytic concepts could be useful in short-term care and like interventions? And do you think it could be used at all?
So I'll say I definitely think that it could be used. And I really like how you were able to, throughout your presentation, explain how different behaviors may surface, the unconscious behaviors. And specifically for this question, when you talked about how there are children that are so young that they may not actually be able to identify their emotions or understand how to explain what they're experiencing. And so doing like psychoanalytic approach might not work for them because it's not like anything they can comprehend or actually work on or engage in. It can be used with the foster care caregivers, right? Because you can help them understand the way that the behaviors display as a result of the trauma or the experiences that they have been through. So, like specific behaviors that are happening, whether it's bedwetting or um, acting out in aggression, it may not mean that they don't necessarily want to be there or that they're angry with them or that they are aggressive in general. It's just a way that they are, their emotions are dysregulated. And so it's something that's happening. So understanding their experiences and how these behaviors are a result of that because they can't comprehend how to deal with them could be beneficial in helping the actual caregivers and then ultimately helping the kids, you know? Um, so I think that it could be helpful. Some other ways I think is just making sure that you talk about like transference. So the anger and aggression that they have with their family members or caregivers, whoever was taking care of them, like their primary biological, whatever it is, and the trauma that was imposed on them while they were in their care and the anger and aggression that they have towards that, the feelings that they have towards that, they're transferring this to their foster parents. And so they have to figure out a way to be able to create a safe space for them, right? Which is like containment. And that is taking their emotions, taking their thoughts, the words, the aggression, everything in, and rather than reacting quickly and impulsively, the adult, the caregiver takes it, processes it, thinks about it, maybe reaches out to somebody to talk about what is happening and ask for some advice, and then deliver it back to the child in a safe, compassionate, validating manner to show them that it can be managed differently in a more safe and caring way. So that's like my take on that. What do you think?
Adding to what Kendra was saying, I think while it can be beneficial to some clients, especially if we're looking at like children in the foster care system, it's definitely not something that can be applicable to all because then you're also looking at like the age range of kids in the foster system, right? Because you can look at kids as young as like 2 and 3, and then you have like our adolescent stages where it's like, the just before they age out of foster care, right? It's not always applicable. And then whenever you want to like,
Mm.
it's almost like rewiring their brain, kind of like unlearning a lot, and then just kind of also at the same time recovering from these trauma experiences, whether the trauma happened before going into foster care or happening during foster care. Because I know like there's unfortunately a lot of programs that just like aren't that beneficial to the kids and don't give don't take care of all the needs and the care for each kid as necessary. It's too many layers to cover all at once, and it can be not done within a short period of time, right? Some kids, unfortunately, are in programs like this for a long period of time. And it's something you have to be consistent with and patient with, especially when it comes to kids. Structure is a major factor. But on top of like them already kind of their mental development already being kind of fried from all the trauma, it's a lot of layers to really apply to all the kids if trying to use that to help and regulate their needs. That's
Yeah,
my take on
that's valid. I definitely hear you on that too and agree. So that, yeah.
Yeah, what
Because
both of you said is extremely true. Go ahead.
sorry, I lost my train of thought. Because it's like you can start it and then again, like there's other kids too, right? That have that need as well. And you can't expect all of them to have the same progression. And it's just like,
Mhm.
well, you can start it, what happens once they leave, right? Because you can't always um um
Follow along.
be assured that it's going to be
Mhm.
consistent thereafter, like especially with kids
Mhm.
development, it needs to consistently happen and not until you see the improvement, but like enough where they can function well enough to function in society.
Mhm.
Exactly. And like both of you kind of mentioned, I think Paola, you mentioned it first, but they all go through it so differently. And two kids can have the exact same experience and have two completely different reactions. And so it is kind of a long-term goal of just figuring out what's going on for them and how to best help them. And it's not a like a one size fits all here. It's more like every single person needs something different and needs different ways to be able to get through it and to be able to be their best self. It's not just something that you can go through the same script every single time. And that actually kind of leads to my next question, which is that so the theory was developed by middle-aged white men to be used in very specific contexts. And so, if you were going broader here, what adaptations would you say would make it applicable to more diverse populations? So, older adults, people with disabilities, people of color, like all of the marginalized groups, what would you say would need to change?
You want to go first? You want me to chime in?
You can go ahead.
Okay. So I personally think that this is a great question. Sorry, I just got the notification. It's going to shut down soon. So let's do this. This is a great question. So while classical theory focuses on internal drives, the conflict isn't always about what's happening inside for a lot of people. Like there's the diverse populations, like you said, for people of color, for geriatric, or for young kids, like we were just talking about. Like everybody has a different situation based on um, like society around them and oppression and social injustice and everything like that. So as social workers, we need to make sure that we recognize the social unconscious, um, whether there is internalized bias or prejudice that the clients might be experiencing, and from society without realizing it, and maybe they don't even realize it, right? But for individuals of color and LGBTQ or people with disability, like hypervigilance is a thing, and it is a necessary thing. It's a survival tactic, right? Because of the world that we live in, the current administration. To be real and to be honest, I don't know if I can say that right now, but like it definitely creates fear. So if you are in a marginalized population, marginalized group, especially like youth who may not fully understand it or only hearing what their parents are saying. For example, I worked in a school that was predominantly Black. And so I'm a white clinician working with all Black youth, and they're being taught don't trust white people, right? Like they're against you. So while some people might look at it as paranoia, it is actually a survival tactic. Like they have to be aware and make sure that they are safe as they're going through different things. So that's a little bit of how I could respond to this. um, and how it needs some changing and modification to really include more of like the social oppression and anti-racism, all that stuff, you know.
Yeah, it's definitely important to acknowledge a lot of those external factors, right? Because it can also have the client feel like they're at fault, right? And if they see us
Hmm.
also accepting and acknowledging that there's external factors that are causing a lot of the problems or situations that they're dealing with, it gives them the reassurance too that like we see it and here's how we're gonna look, this is how we're gonna do, right? Like this isn't victim blaming. This isn't like, well, you can do things differently, but like it's having to understand like everything going on around us can and will impact us as individuals. So it does definitely have to expand more and be more culturally competent when it comes to like the cultures, the backgrounds, especially with groups like LGBT, are from different races, disabilities, like all those are again like different factors that have to be included, and we have to approach that differently because again, it can't be applicable the same way, because not everyone's impacted by the same external factors as the next person, right?
Hmm. Right. And like Annie said, when talking about the youth and how you need to do some reframing so that they can understand, like you still have to do that with adults, right? Because sometimes they grow up and either they're sheltered or they're told one thing or they just try to fit into that so that they can like protect themselves. And so they're going through different experiences like, I can't find a job. I'm being told I'm not professional enough for this position, or I'm not qualified enough. When reality, it could be because they're black and they have locks, right? Like so, being able to help reframe it and say, look, like you are qualified. You have the education, you have the experience, you are deserving of this. The reality is that this company is predominantly white and you might not just fit it. And that's not a problem with you, it's a problem with society. So helping them see that their failure or their setbacks or whatever is going on is not, it's not their failure, it's not their problem, and just supporting them that in that way and being able to help them um, figure out ways to navigate it and be more optimistic about their future and that things can change and improve.
Exactly. It's more of looking at it in a systemic way and helping them to see that and see that it's not just them. And so to bring them back to those NASW core social work values of you're
Mm-hmm.
important, you are this. It's just that sometimes the system will fail you. And
Right.
unfortunately, it does happen a lot more for marginalized communities, just the way that people are, which is especially code administration, all of that. And it's sad to say, but it's unfortunately a fact. And so I think this
Mm.
kind of theory and this kind of way of helping people will become a lot more important again in the coming years as a lot of these bigger things are going on.
Yeah, for sure. And I know like sometimes people, this is kind of off topic, but it's also still there. Like when I was talking about the social worker just making sure they check their bias and things like that, right? Because you want to make sure you're creating a safe space for your client or patient, whatever setting you work in, student, right? And when they're coming in and you make comments like, I don't see color, you are dismissing their entire experience as a person of color. And while it might feel like you're being supportive and showing them that you care and you want to help them and whatever, it's not the way to go. And so you really have to pause and think about the way that you're responding or reacting to situations. And then also it's their experience, right? So if it is extreme to them, then it needs to be extreme to us and figure out a way to be able to help them manage it, navigate it, and figure out ways to, change their reality.
Exactly. It's all about just taking what we know and what we learn from these theories, not just this one, but all of them, and applying it to real life and using it to help these people be able to have the best outcomes they can and mixing
Yeah.
and matching to whatever works and whatever is going on in the world, figuring it out as we go and just helping them to be able to be the best versions of themselves. Because at the end of the day, as social workers, we just want what's best for them, no matter
Yeah.
how we have to get to it.
Hear that.
There we go.
All right, I'm gonna go ahead and stop recording because it is going to cut us off.
Yes. Do you want to meet right back?